All right, we will go ahead and start the webinar. So good morning again to everyone. My name is Malik Shamsuddin. I will be the moderator for today's webinar. Please note that everyone's line's been muted so that you can hear Grace, our speaker, correctly. And you will also have the option of using the chat box. So feel free to ask questions, use the chat box. It should be in the bottom of your screen. And we will, towards the end of the presentation, we will start answering questions and have a Q&A session. So without further ado, today's speaker is Grace Hare. Grace is the health insurance and benefits expert here at IX Solutions, and she's been here for 2 years. Her sole responsibility at IX Solutions is to research and educate individuals on their healthcare options. She is our go-to person when it comes to healthcare. Now I'll go ahead and hand it over to Grace, and she'll go through the webinar with you.
Thank you, Malik. Good morning, everyone, and thank you for joining me today. The goal of this webinar is to arm you with the tools you need before making a transition into a new plan this open enrollment period. So I want to tell more about who we are. We are the health and benefits partner of the Chicago Bar Association. CBA has partnered with us to give you access to our team of licensed agents. We have over 29 years of experience in the healthcare industry. So whether you're an employer looking for group coverage or an individual looking for family coverage, we can help you find the best plan to fit your needs. On the CBA Benefits Exchange, you can enroll in health insurance as well as Medicare, life, short-term, dental, and vision insurance. There are live chat features available, so you can get immediate assistance from any member from our team. So if you haven't visited the CBA Benefits Exchange already, you should check it out. It's full of educational materials, and it's where you can enroll in a health insurance plan. And I want to start today by explaining what the rules and regulations mean for you and your health care. The Affordable Care Act, also commonly known as Obamacare or healthcare reform, and it is a law. It was originally created to make healthcare more accessible and more affordable for more people. No one can be denied coverage under this law, and everyone is legally required to have coverage. Every individual health insurance plan sold is required to cover the 10 essential health benefits. That means no matter which plan you choose, it's guaranteed to cover vaccinations, physicals, mental health services, and outpatient care. Now, keep in mind that's as long as you're receiving these services in network. That does not mean these services are now completely free. One way to shop on exchange and how to know when to shop off exchange. So one way the government works to make health insurance more accessible to those who can't afford it is by offering subsidies to those who qualify for lower healthcare costs. Subsidy eligible plans are what we call on exchange. Off exchange plans are simply all on exchange plans, but more. So there are more plan options available when you are shopping off exchange. How do you qualify for a subsidy? This is a common question we get. Only 3.5% of the population qualifies, and this is determined by where you live and how old you are. For an individual to qualify in 2018, your annual income must be between approximately $12,000 and $48,000 a year. Even if you meet these requirements, your subsidy could be as little as $2 per month, so keep that in mind. That's if you're on the higher end of this scale. So I want to also mention that both on-exchange and off-exchange plans are subject to the Affordable Care Act. So both include those essential health benefits I touched on before the slide. And you do have access to shop both on-exchange and off-exchange when working with us. I'm now going to touch on some industry updates. So what's going to be different in 2018? While the media sometimes makes it seem like everything's going to be different, reality is how the market's been the last few years is largely how it will be in 2018. So if you've been shopping individual health insurance for the past couple of years, expect to have a similar experience. Every year, insurance carriers must decide two things. One, are they going to offer a product at all? And two, are they going to sell the same plans they did last year? Blue Cross Blue Shield of Illinois will be offering an individual product again this year. However, they are not going to be selling the same plans as last year. The networks will remain the same for those of you who shopped individual last year. It'll be those same 4 networks, but the plan structures will be different. Some of you may have received a letter saying that your plan is discontinuing at the end of the year. Blue Cross will do their best to map you to a similar plan. And if you want to explore other plan options, if you're not happy with that plan you've been mapped to, we're here to help you come open enrollment period. So this year, the enrollment window is 45 days. In previous years, it has been 90 days, so that is a change for 2018. It has been shortened. The deadline to enroll in an individual health insurance plan is December 15th. So as long as you enroll between November 1st and December 15th, you are guaranteed a January 1st effective date. So let's go over the carriers available in 2018. We will be supporting Blue Cross Blue Shield again this year. We have watched many other carriers exit the market in the past year. To name a few, Land O'Lincoln Health, Aetna, United Health One, Coventry, and Harkin have exited the individual health insurance market, so they do not offer a product anymore. We trust Blue Cross that they are not going anywhere. They have been the only stable carrier in the individual market since 2014. They are not the only available carrier in Illinois. Ambetter and Cigna do have one HMO option available, the Ambetter Balanced Care and Cigna Connect plan. But this is another reason that we've picked Blue Cross, is to give you more plan options. Blue Cross Blue Shield has a PPO option, as well as 3 HMOs available, including the largest HMO network in the state. So now I'm going to go over those networks. There are 4 total networks, as I mentioned, and there's a total of 14 plans within these networks. That is less than last year. There were over 20 last year. The networks and plans available depend on where you live. Part of the reason that there are less plan options available is they did drop the platinum plans. Those are no longer going to be available. So this year, the lowest deductible in the market is $500 for the gold plan options. First network and the largest is the Blue Choice Preferred PPO. PPO, if you're familiar with having a PPO in the past, it offers greater flexibility in your health care. So you can choose which physicians you want to see, no referrals required. This specific network is available in all counties in the state. As you'll see, the map shaded the entire state. This does not mean, however, that you are covered no matter where you go for care. I want to mention that this network does not include major teaching hospitals such as Northwestern, North Shore, Rush University, and University of Chicago. The Blue Precision HMO, this is the largest HMO in the state, and this plan allows you access to North Shore Physicians Group. So if you've been happy with care from North Shore in the past, this could be a great option for you. I want to mention that last year this network covered Northwestern, and this year it will not. So that is a change for this year. Northwestern is not participating on any of the 2018 health insurance plans in the individual market. For those of you who aren't familiar with an HMO, you have personalized care with the primary care physician. They coordinate your care. Referrals are required to see in-network specialists. This helps keep costs low and predictable when it comes to an HMO. Next is the Blue Care Direct HMO. This utilizes the Advocate healthcare system. You can call today in Advocate and be seen by a primary care doctor same day. If you normally utilize Advocate healthcare system, hospitals such as Illinois Masonic, Lutheran General, this plan may be the best option for you. Last is the Blue Focus Care HMO. This is a micro network available in Cook County only. It is the most restrictive, but for that reason, it is the most cost effective. Okay, so now I'm going to go over some tips on how to select a plan. I always recommend you first start with looking at your personal priorities. So is it cost? Is it seeing a specific doctor? If you have a doctor in the North Shore Physicians Group, for example, that you must see, this limits your options to the Blue Precision HMO. For many, it's a combination of cost and hospital access, but...
Hold on one moment. It looks like the connection is paused. Give us a few seconds. Give us a few seconds while we fix the connection. Okay, we should be back on.
Sorry about that, everybody. I'm going to start this slide over in case you missed anything I said. So I want to give some advice on how to pick a plan. I want to start with identifying your personal priorities. So whether that be cost or seeing a doctor, for a lot of people, it's a combination of the two, but this helps you move on to pick a network. You'll see step 2. So if you have a doctor, for example, in the North Shore Physicians Group, this would limit your options to the Blue Precision network. So that's why I always ask you to first determine your personal priorities, because that would narrow down your options and help you pick a plan. You wouldn't want to even look at plan options in the Blue Care Direct or the Focus Care because they wouldn't have access to your doctor. So that's a great way to narrow down your options. And then I ask that you determine, are you a high utilizer of healthcare? So a good way to know whether you're a high utilizer or not is if you've previously met your deductible. If you've never come close to your deductible, I would recommend enrolling in a high deductible plan to lower your monthly costs. High deductible plans typically have a lower monthly premium. If you'll see the image of the lever, health insurance plans work on a lever in that when a premium's low, the deductible goes up and vice versa. If you have expected medical procedures and you know you're going to meet your deductible right away, you may want to select a plan with a lower deductible so you can benefit from those carrier reimbursements sooner. I'm now going to talk about the structure of a health insurance plan and how it functions. So when your coverage kicks in on January 1st, everything is subject to your deductible except copayments. So let's say you have a $1,000 deductible and $45 copays. Everything's going to be subject to that $1,000 deductible. Once you've met your deductible, your coinsurance kicks in. A typical coinsurance structure is 70-30 split. What that means is the insurance carrier pays 70% of the bill and you pay that remaining 30%. And that structure continues to go on until you've met your out-of-pocket maximum. Then the carrier pays 100% of the bill after you've met that out-of-pocket max. Okay, so let's prepare for open enrollment period. As I mentioned, this year it's 45 days. That window has been shortened to enroll. The first day to submit an application is November 1st. So we recommend, contacting us at that time, starting November 1st. We'll not be able to help you run a quote or enroll in a plan prior to then. This is the only time of year that you can change plans. So you can either enroll in a new plan or keep your existing coverage. As I mentioned early in the presentation, many of you may be mapped to a new plan this year, and we're here to help you explore better options if you're unhappy with that mapped plan. For those of you attending this webinar, we will be emailing you an enrollment guide that goes into more detail on the topics I covered today. So we will send that to you within 24 hours of this presentation. That's all I have for today. We're going to open this up to questions. So I see some questions sitting in the chat box. Mullik and I are going to go through and answer as many as we can.
So first of all, I do want to apologize for the technical glitches we had. The connection somehow timed out. I did receive some text that said go back to a few slides. So first slide I'll go back to is the Blue Precision HMO slide. We'll explain that a little bit again. And then we'll also go to the other slide, the Blue Focus slide that was asked for. So give me just a moment. So Grace, they just wanted to, if you can just say a little bit more about the HMO network again.
Yeah, of course. The Blue Precision HMO Network. For those of you that were enrolled in it last year, you may have enrolled in it because Northwestern was being covered. This year, Northwestern is not going to be covered on this plan. In fact, Northwestern is not participating in any of the individual health insurance plans in 2018. This year, this network is allowing access to North Shore Physicians Group. So if you've been happy with care from North Shore in the past, this could be a great option for you. And it is an HMO. So again, for those of you not familiar with an HMO, you would have personalized care with a primary care physician. They coordinate your care. Referrals are required to see a network specialist, and this helps keep this low and predictable. It's available in the greater Chicago area, and as well as Peoria and Bloomington counties.
And then this is the only one that has the major teaching hospital, right? The
North Shore.
Just one of them.
Mm-hmm. Just one.
And then lastly, the Blue Focus. This was the other slide that it didn't show while we were talking. I think
Okay.
That's when the connection problem occurred. So just, I believe they were able to hear you. They just weren't able to see the slide. The one thing to take out of this slide for whoever's was interested in this, it's the least restrictive. So you have to be in Cook County, and it has select hospitals and doctors only. So if your doctor is in this network or your hospital, that's great. There's a lot of cost savings. It's a small chance they would be in it. However, or the other option is if you don't use healthcare at all and you just want to have a low cost plan, this may be an option for you. But and next we'll go to some other questions that someone had.
Okay.
So there was a question. I work at a small firm. The owner and I are attorneys. We have 3 staff. Could we start a group plan just for me as an attorney? And the firm wouldn't be offering to the staff. So here's how it would work for small groups. So yes, you can start a small group plan with just as low as 1 employee or even 2 employees. You do have to offer it to everyone, but that doesn't mean that you have to give them any contributions. There is a special enrollment period that starts November 1st and it will go through December 15th, where, and specifically when it comes to Blue Cross, where you can offer, you don't have to have any participation requirements and you don't have to put any contributions into it. So it really wouldn't cost you anything, even if you did offer it to your staff. And that way you can get a group plan as well as anybody else who's interested in it. So of course you can give us a call and we can talk further about that, but I did want to address that question. Next question, can you decline any of the essential services like maternity, newborn, and pediatric care to save money?
That's a great question. No, unfortunately, they are built into the plan. So that's under the Affordable Care Act. These services are considered essentials by the government, and they are included in every healthcare plan required to be covered.
Next question, and I think I'll take that one, is what do you suggest to individuals that need to go to Northwestern? See, that's going to be the, I'm sure that's a question that a lot of people are interested in. And, you know, unfortunately, when it comes to these plans or individual health insurance plans, there's nothing that would cover it. Me personally, if there's no way of getting a group health plan, I would say the best option is to get a plan that's called like a critical illness plan or a accidental plan. What that does is that in case something major happens, it will pay you cash benefits. So it will give you, for any injury, like if a critical illness does occur, they would give you money. And then you can do whatever you want with it. So if you want to go see somebody at Northwestern, of course, you would pay with your cash. That's one option, of course. And the second thing is, of course, working with your doctor at Northwestern to see if there's, we've heard some individuals work with their doctors to come up with some special arrangements. But that's one of the only ones we have. Next question, will sole practitioners be able to join groups in 2018 to get better plan rates under the new government? So the government regulations are still the same. If you're a single person, you can't set up a group. unfortunately. The government still doesn't allow a way for solo practitioners or solo individuals to join a larger group. That still hasn't changed. Is there any way, oh, I think that was just, hold on one second while we review these questions. So yeah, of course we had a couple questions about solo practitioners. So, you know, if you have one employee, of course we can get you onto a group plan. Other than that, you know, we really can't form a group like a CBA association group that everybody would be able to join. That just isn't allowed yet, or we can't do it. We are working to find other solutions. But at this moment, we don't have that. It would just be through the individual market. I mean, of course, yes, you can give us a call. When you go to the CBA page, there will be a phone number. It will direct you to us, one of our associates. Or Grace is great to work with, so of course, you can ask for Grace, and Grace can also work with you. I'll go to the last slide where at least our contact information is there. Oh, well, we just went there. Here you go. And I'll just wait a couple more minutes. That's all the questions we had so far. Oh, there's the queue.
So I see another question that says, if I go to the doctor for an annual physical or for a cold, do I have to pay the full doctor's bill until the deductible is met? Or is that routine care excluded from the deductible requirement? So if it is routine care, such as an annual physical, yes, that is excluded from the deductible requirement. However, for a cold or any sort of illness that comes up for a physician's visit, that would be subject to the deductible. If you have co-pays, that would be a set dollar amount. So look for a plan with co-pays, because that's a great way to control your costs there.
So one thing I want to mention is, so yes, it's excluded from the deductible, but just remember, annual physical is included at no cost. These are things that are built in. So if you're going to get a health, if you have, well, you're required to have a health insurance plan, and those, all plans include free annual checkups and those physicals, those preventative services. So make sure you take advantage of that. As Grace was mentioning, of course, when it comes to a cold or something that you need to get looked at, there will be a copay or paying towards your deductible, whichever way you want to do. If you feel like you're a low user of the healthcare system, maybe a high deductible plan with no copay could work, but that just depends on your situation. So the other question, is treatment for addiction subject to a deductible? So yes, that would be subject to deductible, meaning it's not a preventative service or a free service. So please note that when something is subject to deductible, that doesn't mean you're paying the full price. So depending on the plan you have, so let's say you have the PPO plan or the advocate plan, the carrier has negotiated rates. So you're not paying the full price. You're paying the negotiated carrier rates that would be the bill that would be sent to you. And anything you pay would go towards the deductible. And the sooner you meet the deductible, the sooner all the other costs are being paid through the carrier, and less you will have to pay it. So that's just one thing I want everyone to keep in mind is that, if you're going to be using the system and you feel like you're going to see the doctor more often, find a way to get to your deductible so that you can go for all these other services that we carry.
Another question says that I understand the copays do not kick in until the deductible is met. That is not true. You may be thinking coinsurance. That is the percentage that kicks in after the deductible is met. Copays are effective immediately when the plan starts. So if you have copays on your plan, you see that set dollar amount on your health insurance plan, that is prior to the deductible. You pay that set dollar amount throughout the life of your plan.
So I would like to add to that too, is saying it's not a one or other thing. So sometimes you may pay a copay and pay costs towards your deductible, meaning the doctor, you came in for a visit for a cold or something, and then the doctor did extra procedures for you, or did use some physical lab equipment and they will charge for that. That's not covered in copays. Copay really just pays the visit itself and for regular checkups. So something to keep in mind, and it's hard to go in details with that because it depends on how the doctor bills. So one question was, when you say Northwestern is not included, does that mean Central DuPage Hospital? Not necessarily. Central DuPage Hospital still may be covered, and that's a really good question. What we can do is go back and take a look at that. I'm pretty sure Central DuPage Hospital should be available in one of those networks. But we could double check that for you. And of course, feel free to send us an email if you do have that question, or if you're interested in it, we can definitely answer that for you. Okay, so question, will CBA be offering a group plan that I can join as a member? I previously covered it a little bit, but what CBA is not able to offer at this moment a group plan the way you would want it to, the way you may be thinking, where a CBA offers a group health insurance plan and then solo practitioners can do that. According to the way the law is right now, you would have to set up a group plan, and then you'd have to have W-2 employees working or 1099s in some ways. So at the current recent future, or at least what we see, we cannot do that, and it will not be offering group health insurance. Hopefully that answers your questions, but definitely feel free to call us if you have more questions about that. I do want to remind everyone that we will be having a group webinar for employers, small business employers and large business employers. That will be 2 o'clock Central Time today. If you need a link, you can definitely reach out to us and we can send you a link. But it will be held at 2 p.m. today for the group health.
I see one more question that's come in, and I think we might be bringing this to a close. Is it just Northwestern Hospital that is not in the Blue Cross networks, or are the doctors groups like Northwestern Medical Faculty Foundation out as well? Yes, that Medical Faculty Foundation would be out as well. It is all Northwestern physicians and facilities.
And the best way to check on this too is we do, when we get on when the new website's launched, the new design, there's a option to search for providers and networks. That's a really good tool to use because things can change at any time, right? So but that website will be the most live one where you can go and see what Blue Cross says is in network and out of network. So you can hit provider search, type in the doctor you're looking for, and you can see what networks are they in and out of. And of course, the second thing and the best way to double check is by calling your doctor's office and saying, here's the plan options I'm looking for. Will you be covering this?
Okay.
And that brings us to the end of this webinar. We really do appreciate the questions, and I know there may be more questions out there. Please feel free to email us, call us, any way, shape, or form. We are willing to help you. Thank you again for joining us.
Yep.
Goodbye, everyone.